Thank you, Emily. And thank you all for spending part of your Friday night here with me. I feel really excited to be here in New York and at SVA. SVA is a special place in my heart, having been an adjunct here for a couple of years teaching adult development and aging and the research class. So great to be back here. I was really happy to walk down the hallway and see the painting studio, and it's just really great to be back at an art school. So I'm very happy to be here. So I'm just curious who we have in the room. I'm wondering how many people are art therapists? Okay. Other forms of creative arts therapy? Okay. People interested in gerontology?
Females count? I mean, you know,
sure. And other
that
interests?
wasn't why I came, but.
And you came because, so tell me your interest of being here.
Yes.
Yeah.
I'm an art historian,
Uh-huh.
and I used to work at School of Visual Arts.
Okay.
I do know SVA deep in my heart. And, well, and now I'm working on a potential research project that has some implications.
Okay. Great.
I'm legally blind.
I look forward to hearing maybe more about that later. We'll have plenty of time for questions, and really I want to hear your thoughts at the end of this presentation. So this is kind of a collection of things that I've been thinking about, writing about, talking about for a number of years, and also a reflection on the practice as an art therapist that I've had, and also some of my ideas moving forward. So I'll be sharing that with you, but I'm really looking forward to hearing what you think about all this stuff. If you have reactions, if you have ideas, I'm really looking forward to getting some feedback. So the title of the presentation is Art and Joy, Reclaiming Elderhood. And the reason why I chose this title is I thought that, first of all, the word joy is really important. So often I found that in my training and in the world of healthcare, mental health, we're talking about all of these diagnoses and, you know, goals we're trying to achieve, and yet the word joy is often never really included in that. And yet, what do we enjoy the most in life? Like, what do we strive for? It's not necessarily for increased self-esteem or, you know, more connectedness. Like, it's joy. Joy is part of the things that we really strive for as a human. One of the organizations that I've been involved with, Arts for the Aging, which I'll show you a little bit more about, they actually had the word joy in their mission statement, which I thought was beautiful. And it shows up sometimes in the research that they're doing. And then this notion of elderhood. There's so many different terms of what we call aging, older adults, senior citizens. But this idea of elderhood is one of esteem, one of you know, having, you know, gained knowledge and wisdom. So my understanding of this term is sort of like potential. And this is just, I think they're dog prints. I'm not quite sure. I saw this in the snow in Massachusetts last winter, and it's getting cold, and I think I was thinking about snow, but the heart. So I have a very, very positive feeling about this topic. It's something that I've been very passionate about and have spent my career working with older adults. I find great joy in this work. So kind of a reflection of my feelings about it. So I love this quote from Janine Torsini, who's the director of Arts for the Aging. The arts ignite self-expression and joy, spark socialization and combat isolation in older adults who still are becoming. So that's, I think, a good quote to begin for us today. So I'd like you to find a neighbor, someone you can talk to for a moment, and I want you to think about these two questions. What do you fear about getting older, and what do you look forward to as you grow older? So maybe discuss among yourselves for a few moments, and then we'll share. So this is a really interesting place that I often start when I'm working with students too. You're all here voluntarily to talk about this topic, but sometimes I'm teaching this topic to students who don't want to talk about aging. They're afraid of it. They're afraid of their own aging. They're afraid of people they know aging. They have all kinds of imaginations or experience of what it's like. So I think it's just important to kind of pause for a moment and just to recognize how we each feel about the process of aging, both our own and also ageism that is very prevalent out there, which we'll talk about in a second. So I just want to recognize that there are real challenges with getting older. And so in this presentation, I'm not trying to eliminate that or to ignore those things, but I want to focus on some of the positive possibilities of growing old, because I think that's really ignored often in our society, and there's so many opportunities that have not been utilized. So that's what this presentation is about. So I wanted to show you a little video clip to set the tone for our talk tonight. What do you think?
You know, I think people do leave joy out of the equation.
So maybe it's possible.
Black and white to color.
Say again?
Going from black and white to color.
Going from black and white to color? Yeah.
It's, I can read one word of it, so.
So it was,
It was not accessible.
okay, fair enough. Fair enough.
It was beautifully
So,
graphically
yeah.
designed, I still see enough
Yeah.
to see, you know, how it was laid out typographically for different people.
Yeah. The idea was really to kind of dismantle a lot of ageist thoughts about what aging is versus what it, it also is, which are often perspectives that we don't often think about. So fortunately, we're learning so much about, many people are calling it the third chapter, about older adulthood. If you think about the theorists writing about human development, years ago, everything really stopped at 18, and no one really addressed adulthood. But fortunately now we're learning so much more about unique qualities that older adults have. So some of them are gaining the possibility of being complex problem solvers with life experience. There's so much more ability to take different pieces and moving them together. Navigating complicated interpersonal, social, and politically charged situations. Again, it's another, connected to wisdom. Increased self-reflection, broader identification across the generations, more creativity. This is actually a really interesting fact. There was a study done like in the 1950s where this person declared that a person's creativity decreased after the age of 35. Shocking, right? But this was believed for many, many, many generations. What this person did basically was to take an art history book, find famous artists, and noted in the index how old the person was when they created that work of art that was included in the art history book. I talk about this with my research students all the time because the method is very flawed, but basically someone had curated the content of this history book. So it's not actually looking at creativity. It maybe is looking at volume and productivity, but not really talking about creativity. But actually, in recent studies, we know that artists, older artists, believe that they are more creative, even if they're not producing the volume, that they find that they're able to be more expressive, that they're willing to try new things, much more experimental as they grow older, and taking a lot more risk. So I know many of you are visual art therapists, and I am as well. I have an ATRBC, an LCAT in the state of New York. I studied at NYU as an art therapist. But over time, I've also stepped into this field of creative aging. And so this presentation really is a lot about that. It doesn't ignore art therapy. Art therapy can very much be a part of creative aging, but creative aging is also kind of at the intersection of another kind of broad category of arts and health. The reason why I like this juxtaposition in some ways is it opens up a lot of opportunities. Art therapy is a very small field, and our focus tends to be working more clinically, maybe more individually in kind of closed systems. And yet you have this very large population of increasingly older people in the United States, and there's a great wealth of need and opportunity. And so arts and health is taking that on, creative aging is taking that on. There's a lot of work happening in this area, so I have really seen that, if we're able as our therapists to kind of connect in with these others, that there's a lot more opportunity for us, and we can really be utilized in a greater capacity if we're kind of expanding into this notion of creative aging and arts and health. One of my biggest joys as a teacher is when I have students coming into my class, especially when they're skeptical about working with an older population, and by the end of the class, I'm like, yes, this is the population I want to work with. In part, I love it, so I'm able to share my joy, but there's such potential. So, yeah, there's a lot of work to be done.
Sorry, what's your PhD in?
It's officially in art education, which was kind of just the heading, but really my work was about kind of integrating gerontology and art therapy, creative aging.
Okay.
So creative aging, just a few highlights. I'll just kind of go through this quickly. I'm sorry, it's sort of small print. So what is creative aging? It's a belief that the arts are healing, wellness promoting, and beneficial to the lifelong learning and attributes of older adults. Creative aging professionals provide vital services for aging Americans, helping them to live independently for longer and improving health and well-being for those in long-term care. Who are creative arts therapists? They include professional artists, creative arts therapists, art educators, doctors, nurses, social workers, healthcare administrators, and a lot of other people in related fields, including older Americans and their families. It's really wonderful to go to a creative aging conference. Signa and I presented together at one several years ago in Washington, D.C., and there are stakeholders from all across the arts, healthcare, interested people, artists, art therapists. I mean, such a wide range of people who are coming to these conferences, coming together to figure out how the arts can be utilized to promote healthy living for older adults. Whereas I find at Art Therapy Conference, it's like 1,200 art therapists all crammed into a conference center, so it's a sort of a singular mindset. So it's very exciting to think about all the players who are involved in this field of creative aging. It's something that evolved really quickly, I'd say in the past 15 or 20 years. It's kind of morphed and changed, but basically as it's an expansion of arts and health, art therapy, and it continues to change with research that is connected with the White House Council on Aging, with the National Institute of Science, the National Institute of Health. There's some funding coming from these channels, so art therapists, pay attention to that. Some big money is coming from these government organizations. And so the creative aging movement has also helped to shift the national discussion on aging from one of illness and marginalization of old people to more positive understanding of the capabilities and potential of older adults. Have people heard of the term creative aging before? Some? Anyone?
Brewers Conference.
It was. They have been in Washington D.C. They're pausing it, I think, at the moment. But the national, the arts and health conferences have kind of picked that up. It's also showing up now in the American Society on Aging conferences have a creative aging component to it. So it's kind of moving now to different sectors. So Jane Chu, who was a former chairman of the National Endowment for the Arts, has this lovely quote: "The arts make a valuable difference in our health, well-being, and our ability to participate more actively in the community." So some of the research that we have seen shows how participation in the arts increase in community activities has a positive impact on maintaining independence and reducing dependency. It reduces risk factors that perpetuate the need for long-term care. Also reduce medication, fewer falls, and improvement in morale and reduced depression. So there's actually this really interesting research study, which is now going back, unfortunately, a while. Unfortunately, Gene Cohen passed away, but he did some research actually here in New York and in this community, where looking at how people who are participating in community-based art program run by a professionally trained artist fared against a control group of people who were not participating. And it was really, really amazing how the people who were participating, they went to the doctor. I was actually a research assistant, so I got to talk to these people firsthand, and it was amazing to see how they, after 3 years, they went to the doctor a few times, they felt more connected, they were really bonded with the group of people that they were in this theatrical group with, fewer medications. So there was a marked change in not only their medical health, but also their emotional and cognitive health as well. So that was a really huge study. Some studies have kind of branched off since then. So slowly but surely, we're getting research that shows the effectiveness of this. So those of us in art therapy, or expressive therapies, working with people in the arts, we know that this stuff works, right?
Absolutely.
But it's really hard to prove it, isn't it? So that's part of my struggle, is how do we prove this on a larger scale? How do we show a larger group of people who are listening with money, to invest in large research studies, to invest in the development of more programs? So we'll get to some of my kind of far-fetched ideas later on. But anyway, that's where we are with that. So some of the specific things that I have found in my own research, and I was working in New York, interviewing older women, some of the things that they told me about why art making was important to them, I thought it was really important for me to go and ask people, well, how and why is art making important to you? I don't want to assume. I had all kinds of assumptions, which were mostly wrong. As one of the things is they found that art making was motivating to them. One woman said, "I approach my aging without resentment." Another person who had surgery on her dominant shoulder was no longer able to draw or paint for like 6 months, and she was really, really frustrated. So she started using her left hand. She created this, which was completely different than her typical artwork, which was much more of like a thematic kind of a nature landscape. This was more about action, of colors going in one direction and then the black lines going in another direction. It was sort of this dynamic piece rather than more of a kind of a staid, sedentary landscape. And it really revitalized her, not only in just kind of loosening up and trying something new, but that she was able to overcome her physical challenge in order to continue to make art. So they found that their desire to make art was really motivating to them. Another woman had chronic fatigue syndrome, and her desire to make art was the one thing that kind of kept her going, got her up in the morning and moving to get through that period of time. The other thing that was really, really interesting to me was identity, is that they really thought that their identity as an artist was really important. Now, these are all women who were not professional artists. They were hobbyists. Some of them, took it quite seriously. All of them started this really after retirements. So some of them had taken some classes earlier in life, so they had some skills. But one had said, "I think the painting has grounded the aging." And they all noted that it made them more confident. They found that it was easier to face aging, and they felt more alive. So this was something really interesting, especially as an art therapist, is coming in and who are we working with? Working with patients or clients or participants. But it really helped me to shift and say, I'm working with an artist. We're not talking about someone who's necessarily going to sell their work or hang it up in a gallery or museum, but this is a person who's using artistic tools to express themselves. So yes, they're an artist. And having that identity really helped them to say, yes, I'm an artist. I have this language, I have this desire for expression, and I can go and make connections. I can go into a gallery and say, I'm an artist too. I'm going to look at this painting. They all noted that they had a greater sense of connection. One person said, art has opened doors for me that have nothing to do with drawing and painting. One person, it was so interesting, she was probably 50 years older than me. And she said, it doesn't matter our age difference. We're talking about art. You love art, I love art. You're asking me about my art. It doesn't matter the ages that we are. We have this thing in common. But, that's so true, right? It doesn't matter what our age similarities or differences are, as we have this thing in common. So that was a really important piece. And we know that connecting people to others really helps to contribute to our overall well-being, which we'll get to a little more later. And then also legacy came up a lot with these women that I was talking to. One person says, I feel that everybody is worth remembering. But people deal with their legacy in different ways, but the idea of wanting to leave something behind or leave ideas behind or to share their knowledge with other people. When I worked with this group, also nearby in this community, something that really struck me was, in art therapy, I thought, the art is so important. The artwork, the art process is so important. But what I really learned was that the art was just a catalyst or a tool to bring people together. That this group of people, these are all scenes from the art exhibits we had. You can see the joy on their faces of being able to share their work with their friends and their family. And this is some artworks of some of the participants showing about their support systems. This was a drawing or painting that one woman had done of another member of the art studio. This gentleman had painted his 3 children, kind of supporting him as he was continuing to pursue his art career at the age of 90. So some of the things that would happen is these people would come into the studio, and some people were professional artists. Some people had never made art a day in their life. I had one woman who, 88 years old, working a day a week as an accountant. She liked to trim bonsai plants, but she had no experience making art at all. And she said, I always wanted to learn how to paint. So she would come every Monday to learn how to paint. So here we have someone who's never painted, someone who had their professional life as an artist and everywhere in between, and yet they're all taking risks together and trying something of expressing themselves, of dealing with that blank paper in front of them. It's scary to make art, isn't it? Kind of, the blank paper staring and putting a brushstroke out there. They learn so much from each other, and so much would happen as we were talking and sharing the artwork of just common experiences that people were having, like frustration that they weren't able to make, this color blue the way they wanted it to, or some sort of operation coming up, or visits from family members coming in and the stress involved. So life kind of came into the sessions and into the discussion. So the art was really the catalyst. It wasn't so much the art making itself or the artwork itself, to be analyzed or pulled apart, but it was more about that process of having something that we're all doing together that's bringing this group of people who otherwise didn't know each other together into like kind of a cohesive group that was well connected. So it was really amazing. You know, we would take a little break in August, and this group of artists would still get together once a week. They would go out for coffee or for lunch. They would, if someone was in the hospital, they would go visit that person. So the friendships really continued on outside of this group. So to me, it was, that was the therapeutic part of it. That was the beneficial part of it. So more recently, I've been involved in this project. It was called Creative Approaches to Healthy Aging, and this was a grant funded by Artworks from the National Endowments for the Arts, connected with a housing residence in the kind of Newton, Boston area, along with Lesley University. And so we were funded to provide a creative aging program. So it was much more expansive than simply visual art. We had a playback theater, we had mural making, we had poetry, we had dance and movements, we had a whole range of different kinds of groups and classes. And so there were 4 different residences, and we had probably 25 teaching artists. I was one of the teaching artists. So they were a combination of professionally trained artists and creative arts therapists that went. And the goal of this was to promote healthy aging and also to bring together these communities. So we had these 4 different residences where people were living after having left maybe their homes. And so people didn't necessarily know each other. There were different languages, there were different backgrounds, different cultures. And so the idea was to make the livability better. So the idea was to provide different kinds of arts forms to hopefully bring people together. So some of the goals: building community, having cross-cultural appreciation, increasing self-esteem, improving motor and cognitive skills, and social connections. So we evaluated this program, and they looked particularly at the 4 areas that contribute to community livability. So through the study, they found that the participants were more engaged, not only in the program happening, but just in the community in general. They were more expressive creatively. They felt more connected to the people around them, and they also expressed joy and gratitude as part of the program. So here is playback theater up on the left-hand side. This is one of the art therapy sessions. This is one of the movement sessions. Has anyone ever seen this before? It's called an Octave Bands. It's really great. It was developed by a woman named Donna Newman-Bluestein, who's a dance movement therapist who has worked with older adults, but it's made out of like a really stretchy kind of a cotton poly mix or something, and it has like a little handle, but you can kind of wrap it and make it as long or short. And so the beauty of it is that you literally are connecting people around the room. So if one person pulls, the person across the room will also feel that tension. So like it literally connects people. It's a kinesthetic, and it's fun and it's playful. So
What's it called?
it's called the Octave Bands,
Oh.
like 8 octave bands.
Okay.
I think she has some that have like 16. Some new ones have come out. They're like in different colors of blue. So then there's this other organization I just wanted to show you a little bit about, Arts for the Aging in Washington, D.C. And this one is a grant funded, but it's more of a permanent kind of a thing. It's been in existence since the 1970s, and it serves the greater Washington, D.C. area. And I really see this as one of the best practices of a program that's really making a difference in the world, and it's certainly in its community. And so what they're all about is they bring in creative arts therapists and professional artists to go into community centers, to nursing homes, a variety of places, and sometimes they do a one-time session, sometimes they'll do a series of 8. Sometimes they'll combine like visual art and music, sometimes it will be like simply like an opera group. So they have these different programs, but it's really wonderful and joyful. And as they have been struggling also with trying to do some research to show the efficacy of this, they've been looking at things like observation of caregivers, observation of staff, observation of the teaching artists, to notice how participants are interacting with other people in the room. if they're sitting up, if their heads are up, so like kind of a physical demeanor, and are they smiling? So there's an increase both in interacting with others, sitting up and smiling, especially with the smiling. And many of these people have some form of dementia, so makes it even more challenging then to do research because it's difficult to give them a survey or to interview somebody with dementia to find out what their experience is. So we really struggle with trying to find a way of measuring the efficacy of these programs. One of the best things, though, is to see this in video, because when we see, whether we're in a session or in a group with people or we walk by, when we can witness this happening in front of us, we feel it. I was really happy we have Nisha Sajnani here who directs the NYU drama therapy program, and she was telling me today about being able to videotape some really wonderful work that she's doing with older adults in theater. And I'm so grateful that this is happening because there's so few films or videos that show this work. You know, we see it in our own sessions as therapists, but there's so rare opportunities where we can actually see how this looks. And that's the thing that really makes our hearts sing. And I think that's actually where we can spread the word and get people inspired to contribute, you know, their energies, their funding, whatever, awareness in the world. So I just want to show you, there is one little video from Arts for the Aging that gives you a sense of just what these programs look like.
There are a lot of older adults in our society that are becoming marginalized and less visible.
I think older people in general are pretty much dismissed by the culture.
We tend to cast older people to the side as if they're not useful anymore, or they're a nuisance.
I think it's our duty as a society to make sure that no individual should be left behind, and that includes older adults. Arts for the Aging is an organization that engages older adults, most of whom have some kind of physical or cognitive impairment, in all manner of art making. We seek out professional artists and we train them to work in these settings, these community-based settings, with groups of older adults.
The arts are a great way to bring people outside of the routine or the normal or the everyday and to find the exceptional qualities within themselves.
And if you're asked to participate, you feel very pleased, like you think, gee, I matter.
Some of the folks who are in that kind of the fog of memory, all of a sudden you'll start to see the fog starts to lift. You can see something's coming, some clarity is arriving, and that's really a rewarding moment.
When older adults are regularly involved in participatory arts programs, it actually improves their overall health and their longevity.
I think it might help people to discover some things about themselves that they'd either forgotten or that they didn't realize they still had.
There's some connection that goes directly to the soul with music and with art that we just don't get in the everyday life.
They just come alive. It's like for one part of their day, they're just themselves, they're out in the open, they're expressing themselves, and nothing else seems to matter to them at that moment.
We think about the arts as medicine. A dose of a program of Arts for the Aging is an incredibly powerful thing.
One of the greatest things is to see people that are physically impaired communicate with each other and dance and move and sing.
When Arts for the Aging comes to our center, it's the very pinnacle of experience that we can offer to the seniors.
As soon as I get in the class, the energy from the people enriches my life.
For us, anecdotally, what we see is just the transformational power of the participatory arts, and it's wonderful.
This is a place to have happiness.
Every morning I look forward to getting up. It cheers me up. I love it. I love it.
Arts for the Aging allow us to express ourselves, and it motivates us to dance and speak out, be creative. I think it's just beautiful.
I don't know if you all felt that from the first part of this presentation about the people who are engaged in the art making, what their experience is. Hopefully you saw some joy in the faces that I showed you. But I know as an art therapist, having practiced for a long time, that it works. Like I know it works. Like my students know this works. Like we recognize that there's a huge need. We recognize that there's opportunities for us, and yet it's not happening fast enough. Like our aging population is expanding tremendously. Healthcare costs are through the roof. So here we have all of these art therapists and artists that need work, and we have all of these older adults who could really benefit from cost-effective programming to help them live well. So what are the mechanisms to put it together? I mean, these are like there's much broader questions that aren't so much about like these details of running an art therapy program and being in the moment, which are beautiful, but I'm kind of like really struggling with this larger piece of how do we get the message out there? How do we get more research? How do we get more funding? How do we get more art therapists and teaching artists out there in the world doing this work? So one of the challenges I have found as a clinician and a researcher is finding an appropriate research method that's going to make this work. As I mentioned to you before, like working with people with dementia, which has been a lot of my work with people with late-stage dementia, is how do you accurately measure or evaluate the efficacy of this kind of stuff? So that's what the second half is going to be about, is kind of like some very rudimentary piecing together of ideas of perhaps a way of making the larger argument. So here we go. So in our healthcare world, we're always talking about, people with diabetes, this is how much diabetes costs, this is how much this treatment costs. So we're always talking about illness and the cost of illness. But we rarely talk about being healthy and being well and how much money we're saving by being healthy and well. So I kind of envision this like an iceberg, that we're always talking about this top little tip, but we're often not focused on this part of it. But what if we could focus on this and keep this part going well and not have to worry as much about the iceberg tip? So in my rudimentary connection, trying to link the research between what that has been done in different areas. The research that's been done in mental illness in this country, depression, social isolation, and then arts programs. So we have research that exists in all of these, but it's really difficult to say that an arts program is going to make a difference reducing depression or mental illness, because there's so many other factors involved. And also this is requiring like big money, big research, which just hasn't really happened yet. So I've kind of done a real hack job here. So I'm curious to see your reaction, but we'll just give it a go. So we know there's data out there that 1 in 4 older adults experience some sort of mental disorder. Depression alone affects 7 million people, and it's expected to double just in, I think this is statistics from 2015. So a huge increase. 2/3 of them don't receive the treatment they need, and preventative services are often limited. So that's huge. Those are huge numbers. And we also know that when someone has depression, that there are also other factors involved. It's not just the depression, but they also are likely to have poor health outcomes in other areas. They're involved in the healthcare service more. They might have more disability. The caregivers or people around them are also more stressed out. They have a higher risk of suicide and death. So there's some real serious factors with depression and mental illness. We know that, right? That's not a big surprise. We also know what the cost of depression is in this country. This is one of the many studies, but one estimate is that the U.S. spends $210 billion a year on depression. And so this is including all adults, not just older adults. And this is treatments of depression and also loss production. So if someone can't go to their job or they have to take a leave of absence, so that economic cost as well. But if you just look at treatments, just treating the depression directly, that's $26 billion. That's a lot of money, isn't it? Just for that one thing. So we have data on this. We know this is a really, really huge thing. We also know some of the factors that cause depression. Some of them are social isolation, loneliness, dementia and other kinds of cognitive impairments, major life changes, stress, trauma, and also changes in physical functioning, so like having a heart attack or a stroke, and so on and so forth. So as an art therapist, my domain is not to address this directly. I also, maybe I'll be working with someone with dementia, but I'm not going to bring their memory back. I'm helping them cope with that. Probably I can't directly impact major life changes, but as we saw from some of the research earlier, that the arts program can directly impact social isolation and loneliness by bringing people together, that notion of connection, using the art as a catalyst to bring people together. You probably have seen in the news, oh look, the S dropped, the lonely S there, sorry. There are lots of news stories out there about, loneliness and social isolation. Like it's being recognized finally, as a really major health concern. From The Economist, loneliness is a serious public health problem. Boston Globe, disconnected from other folks, seniors grapple with the loneliness epidemic. Study, I don't know if this study went through. Alarming number of seniors go an entire week without talking to anyone. So this is not uncommon, that depression, loneliness and social isolation is unfortunately a familiar topic. I think that oftentimes, unless we're in contact with older adults frequently, it's hard to really imagine that. Like think about your day today, Friday, think about your week this week. What were your weeks like? What was your day like today? 7 o'clock now on a Friday, so you've been awake since when? What did you have to do today? What were your days like? A few things that happened in your day. Did you go to work? Did you go to school? Did you see anybody? Are you going anywhere after this presentation? What are your plans this weekend? Just tell me all your juicy plans this weekend, but the point is, often, you all probably have pretty busy lives. I know you squeeze coming in here, in between many other things. So it's really hard to imagine what is it like if we are disconnected from people we care about, disconnected from places or things that we might like to do or want to do, because when we're able, we're active and we're connected. So it's really hard to imagine that. But unfortunately, there's a lot of factors that can contribute to someone becoming socially isolated. So if you look at these three intersecting circles, we have the psychological, the physical, and the social. Physical, it could actually be where a person is located. I don't know if you've noticed, like assisted living facilities, for example, tend to all be like on some beautiful hill with trees all around it and some cement parking lot, and there's nowhere to walk to. The staff come in, visitors come in, they park in the parking lot, and then they leave. And there's no place to walk for the people who actually live there. So sometimes just the physical places where people are living, they're disconnected from others. Psychological components, there could be changes in mental health. There could be safety issues. It could be some sort of physical challenge. Maybe they've not had great coping skills. They could have lost a partner. But the social part is really, really huge, as you see here in this section. So it could be language barriers. It could be a change in social network. We see this a lot as somebody moves from one location to another. Perhaps their change of role. This could be retirement, or maybe an illness now means that they have to be cared for differently than they had before. Limited resources, both can be financial and also social. So there's all kinds of reasons that could contribute to social isolation. So we're learning about, there have been different studies that are identifying some of the things that obviously help to reduce social isolation, like increasing your network size, improving the quality of supports, and increasing frequency of social contacts. So easier said than done, though, of course, some of the things we just brought up. But trying to be purposeful about creating some of these opportunities are some of the ways that we can help perhaps bring a person out of social isolation. So going back to Dr. Cohen's study, he found that the impact of these programs where people were coming into arts-based is it improved their health, it reduced their social isolation, it reduced their depression and loneliness, and increased their level of activity. So here are people living in this area, living in it was in Newark, nearby, who maybe weren't all that active in their community, and they began to come to this drama program. And through that program, they became friends with other people, and we found that their social isolation decreased, and they became better off in many ways. So going back to the iceberg video, we know that it's easy to measure the cost of illness, but how do we measure the savings of well-being? Wouldn't that be amazing if we could talk in healthcare about like how much well-being costs and spend our money there rather than only focusing on illness? Wouldn't that be amazing? That'd be a lot more pleasurable too. Okay, so recap. We know the cost of depression, we know what causes depression, and we know how to reduce social isolation from other research. So we know that treating a person with depression, so this is out of pocket with health insurance, and this is for the treatment only. So this is like going to the doctor and getting depression medication. Doctor visit roughly is going to cost $100 a month. Medication maybe $100 a month, and not even including any other kind of medical factors or something that's contributing or as a result of the depression. So it could be up to $200 a month out of pocket for somebody to treat depression. What do you think about these numbers? Does it seem reasonable, too high, too low?
Somewhat too low.
Too low? Mm-hmm.
I think also like getting to the doctor.
Yep.
And how you're getting your medication, that also should
Uh-huh.
be a factor.
So conservative, very conservative number, $200 a month just to treat depression with insurance. So then we have the cost of an arts-based program. So, you know, talking to people around the country that do this work, from my experience. So for a 12-week program, 8-week program with 12 participants, the cost might roughly be $1,200 to run this program. So that's hiring a leader, a therapist, or an artist, $1,000 for those 8 weeks. Let's say it's $200 on art materials, and I'm not sure about the space. Maybe the space is free because we're going into a place that houses people. Maybe it's paid for that, but roughly it's going to be $100 per person for those 8 weeks. So it's $50 a month for someone to go to an arts program. So the comparison, the cost of treating depression ongoing month after month is $200 a month roughly. Participating in an arts program for 8 weeks costs $50 a month. So a big difference there. So here's my hack, sketchy math. I'm curious to see what you think about this model. Okay, so let's say we have someone who's 80 years old. They have a risk factor. So it could be many things. I say loss of family or friends. It could be a medical illness. It could be something. So in the top half, this person now is at risk for developing loneliness and social isolation, which then leads them at risk of depression, which then could also lead on to further risk of other health issues. So we know from the research this is a very possible trajectory. But we also know from the research that the same person, maybe they also have some sort of loss of family and friends, they become socially isolated, but then they participate in the arts program, like maybe one of Dr. Cohen's programs, or maybe the Arts for the Aging program. They get reconnected with people, they meet new people, they start to develop skills in the arts, they can express themselves, they find some sort of joy and happiness. It brings them back here, reestablishing community and well-being maintenance. So hopefully either preventing this or postponing this. Does it seem feasible? Does this argument make sense to you or not?
Yes.
Yes? Anyone skeptical? I like skeptics.
Not that I don't agree with it.
Uh-huh.
It's just saying, how do you know the actual cause of that person's depression at
Sure,
that age?
absolutely.
And would they not, they might still need medication or
Mhm.
still see a different type of therapist.
For
So
sure.
I don't think that it wouldn't work, and I
Yep.
don't think it wouldn't support someone's well-being.
Mhm.
But I don't know that you could separate.
Yeah.
that.
So there's so many factors, and this is like a really rough sketch of like a possibility. So what we need is research to show this. We need comparative research, big study to show this. So maybe you, someone would want to take it on. To factor in like all of the different mutations of what could be going on. Do we really know that it's the arts program that's leading to this, or could it be something else? And maybe something else is going on in their life too, so we have to know. We don't have research right now that's really showing this. But I think if we want big change to happen, we need to show big change with the money. We need to see that the reduction of the cost of something like depression can be really helped by arts programs. And I know that seems kind of like simplistic in many ways, but it seems like the research, some of the research is out there. The trajectory of like an actual research project, needs to happen. And that's my big struggle is that, how do you do it? Yeah.
I mean, I think this sounds really interesting, but
Mm-hmm.
one thing that comes to mind is that some of the people don't go to these programs until they start feeling that. And I keep here thinking like prevention, like how can you get them interested before this?
That's true.
Before
Yeah.
this time.
That's a
So
good point.
How this will work.
Yes. And so then there need to be other systems in place where there are people that can kind of pay attention to what's going on with somebody. For example, this is kind of a tangent, but the mayor of The Hague came and spoke at one of the National Center for Creative Aging conferences and was talking about how they were utilizing services that already existed. For example, if someone was going to check the meter at someone's house, they're going outside, they're looking at the, the electricity meter or water meter or whatever, to also pay attention to the environment. Like if they know that an older person lives in that house, like knock on the door, just like kind of peek around, like is the house being cared for? Are there any other signs that maybe something's going on? So to kind of catch possibly some of those moments before it gets really, really bad. So what we need to do is develop strategies to promote wellness and integrative health, shifting from disease prevention to wellness enhancement, and researching the impact of arts on well-being and illness. So there are some studies that are coming out, like I just saw one where they were looking at cortisol levels of participants in groups, so that's like one factor of looking at stress before and after. So there are some studies, but we definitely need more. So now I'm curious, what are your thoughts and your ideas about this topic, questions you have? I really appreciated the questions that you're already bringing forth in your comments. So I'd love to hear more about just your ideas on this topic, some of the experiences that you have from your own experience.